Hello dear students, I'll show you a clinical examination method which is very important. Look at this, what this examination is. Very common thing. Patient is here, surgeon is or clinician is observing here. See that there is a swelling here. See that typical left inguinal region, groin medial aspect. So typical. So in standing examination is very important for inguinal hernia or for any hernia, abdominal hernias and groin hernias. We have to examine the patient in standing. Clinician should be on the right side. You can sit on or stand. Ask the patient to cough. Then look at the momentary increase in the size of the swelling, or otherwise called as expansile impulse on coughing. Then other features of the swelling in standing initially. Then you should look at the lying down position. Even percussion auscultation should be done in standing position. So examination in standing in hernia is very important. That's why this is examination in standing. Expansile impulse on coughing, I already told, is a momentarily, word momentary is very important. Increase in the size of the swelling during act of coughing or straining. Other examination standing called deep ring occlusion test. Initially ask the patient to lie down, reduce the content with or without axis. Then identify the point out the internal ring, which is the opening in the tonsil fascia just above the mid inguinal point, not mid inguinal point. Not mid point of the inguinal ligament. Mid inguinal point is between the pubic symphysis and anterocephalous spine. Middle of the 1.2 finger above the middle of that point is mid inguinal point. Whereas the midpoint of the inguinal ligament is between the pubic tubercle and anterocephalous spine. Whereas we want mid inguinal point between the pubic symphysis medially, anterocephalous spine and laterally. Same thing, femoral artery pulsation is checked below the mid inguinal point, same point. So internal ring is above the mid inguinal point. So you occlude the ring, then ask the patient to cough, then ask the patient stand with the occlusion. So conclusion of this test is always in standing. Then ask the patient to cough. If swelling appears, it is direct inguinal hernia. If swelling does not appear, release the finger. Then ask the patient to cough. Then swelling appears, that means it is the indirect inguinal hernia. Start with the lying down, then conclude with the standing. Is the ideal method of doing the test is a deep ring occlusion test. Percussion is done in standing always, whether it is resonant, that means enterocele, whether it is dull, that means it is omentocele. Auscultation for bowel sounds again done in standing. So all important. Examination in standing is most important thing in any hernia, further groin hernia, in also ventral hernia may be primary ventral hernia or incisional hernia as such. So remember deep ring occlusion, remember Demon test, 3-finger test. Like this, in the ring, index finger over the deep ring, middle finger over the external ring, and ring finger over the saphenous opening in lying down position. Ask the patient to cough wherever impulse appears. It's not very important test, but it's mentioned in the books. You will be asked in the exam. The test is the deep ring occlusion test. Rectal examination is important for prostate and any stricture which may cause for straining, increase in endothelial and hernia. Scrotal examination for a testis. And bulbar urethra examination, after lifting the scrotum in the midline, in the bulbar urethra, thickening or crescent depression may be felt. Thickening mainly for the stricture, may be the cause for the straining in urinary stream, and it may be the cause for the increased intra-abdominal pressure, and so hernia. Opposite side is important, maybe bilateral. Patient may tell I got only one side, but other opposite side hernia may be there. It is your business to examine opposite side. Abdominal muscle tone for head rising, malgagny bulging in the front, or Malsolo maneuver like this or like this from the lateral, or the lateral aspect of the lateral muscles may get weakened. So both front and lateral muscles should be checked. Malgagny bulging, Malsolo maneuver like this. And respiratory system is important. Bronchitis, tuberculosis, asthma. Spine examination, spine deformity may weaken the abdominal muscle, may cause hernia. Abdomen examination, ascites weakens the muscle and hernia can occur. Like umbilical hernia is common in ascites, same thing, they can cause groin hernia also. So examination, all these examinations are very important in these patients. So answer the MCQ. Pantaloon hernia is bilateral direct inguinal hernia, unilateral indirect and direct inguinal hernia, direct hernia on one side, indirect hernia on the other side, bilateral indirect inguinal hernias. Students, put the right answer in the comment box. I will get back to you tomorrow. So answer the MCQ again. Boundaries of the cell bite triangle is inferior epigastric artery laterally, lateral border rectus muscle medially, pubic bone below. Inferior epigastric artery laterally, medial border of lateral medially, inguinal ligament below. inferior epigastric artery laterally, lateral body lateral muscle medially, inguinal ligament below, inferior epigastric artery laterally, conjoint tendon medially, inguinal ligament below. Answer, give the right answer. I'll get back to you tomorrow. Student, please write the answer. So students, always go through my SRB's clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic. For example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on. All topics with the video contain lot of photos and illustrations. So students, I hope you have understood. It's very important examination or standing for groin hernia, ventral hernia very well. You should do it always in all hernias. Thank you so much.